when you see torii, mandibular torii, lingual torii, palatal torii, or labial in the maxilla or mandible exostoses, they're all basically hard bone laid down around the teeth due to bruxism. And that's one of the facts that most young dental students don't learn in dental school, that torii are associated with bruxism. So when you open somebody's mouth and you see any of those torii or exostosis, you can be assured that that patient has a history of bruxism. That's one of the reasons I can tell you that generally half the population, clenches or grinds their teeth, has bruxism.